Okay, let's pretend you are now a doctor and you have a patient that comes in. Let's say our patient's name is Harry Dawson. And so this Harry Dawson comes in and he has some symptoms that he's been experiencing. So, for example, he's been losing his memory a lot. So, for example, he misplaces his keys or random objects and he forgets about them. And he's also been experiencing a really drastic decrease in productivity in work. He also has some weird trembling in the feet as well as in the hands. And all of this makes him just depressed because he notices that his situation is just getting worse and worse. And this is really bad because considering that he is only 25 years old, he really finds it strange. And so you take some notes on what you observe and what he tells you. And you also notice that he had a lot of facial grimacing and pouting, which he doesn't seem to be controlling and that he is not really aware of. So, if you didn't know what the disease was at this point, would you be able to tell what our Harry Dawson has? Probably not. So, as a doctor, then you take up further history on our Harry Dawson to see what is up in his family. And that's when he tells you that actually his father died at the age of 50 because of a disease. And he doesn't know which disease it is because he was really young, but his father's father also died because of a disease at the age of 60. And then he also says that his mother died at the age of 47, but of something completely unrelated. So she died in a boat accident. And then he also says that he has a daughter, and we can just call her Rose Dawson. And so right now, because of this history as a doctor, so for example, this doctor actually has a hunch already on what our Harry Dawson could be experiencing. But to be able to prove this, he actually does some more testing to be able to make sure of it. And what he does is a DNA analysis, and more specifically, gel electrophoresis. So if you see here, he basically takes a certain gene, we'll keep it like mysterious for now, and he finds a section which has CAG repeats in exon 1 of this gene. And so he uses PCR, or polymerase chain reaction, to be able to amplify the section that he has, and then he uses gel electrophoresis. So the way that it works is because DNA is negative, you basically use a restriction enzyme to cleave the DNA, and then you place it into agarose gel. And then you pass an electrical current, which has a positive and a negative pole. And because the DNA is negative, it will then move to the positive pole. And if you look at this image right here, you can notice that this is an image of the agarose gel which is used. And you can imagine that if you have a small fragment of DNA that passes through this, it would be able to move within it quite far. Whereas if you have a larger piece of DNA, it would be able to pass through, but much slower. And so that's how you're able to organize in a way the DNA fragments that you have according to their size. And so he does this at this specific area, and this is what he gets. So if you just look at the pedigree at the bottom here, so here this represents our Harry Dawson, this represents his daughter. And what you notice is they both have something in common. We'll talk about the results more specifically later, but you can observe here there is something abnormal that other relatives do not have. So from these results, our doctor is then able to diagnose our Harry Dawson. And he has Huntington's disease. So Huntington's disease is a neurodegenerative disorder which is progressive, and it is transmitted in an autosomal dominant way, so it is a genetic disease. And so we'll talk a little bit more about how did this doctor actually figure it out. So, but first, let's just look at what the CAGs repeat actually mean and how they're formed. So remember the DNA fragment that I talked to you about before? It had CAG repeats. And how did these occur? So here you have a DNA strand. You can imagine that each piece here is one CAG repeat. So normally in the body you have these CAG repeats, like you have a certain amount. But during translation, you can see here the new strand is being replicated on it, but at some point it accidentally detaches at a certain area. And the problem with that is that it then rearranges. So here you can see it almost makes like a loop. And then translation keeps going. And also you might notice that here R3 and R2 are able to bind together because each of these are the same repeats. So they would still match up. And the problem with this now is that our newly synthesized strand actually contains an extra repeat. And so this is how there's actually more repeats of the CAG. And so what is the real problem with this? So do you remember the gene that I talked to you about before? So this is actually the HD gene, which stands for Huntingtons. So it is located at the 16.3 area, so fourth chromosome, and there's normally CAG repeats. And so normally here you can see this is our gene, and all the ones that are in brown here are the CAG repeats. And these code for glutamine, each of them. But the problem is if you get like more CAG repeats like these, you can see there's more, it starts creating polyglutamine, which just means that there's more. And the problem with that is that normally the overall gene codes for Huntington, but our new protein which has been synthesized that has polyglutamine in it is a sort of mutated Huntington. And so when we look back at this right here, so do you remember this was Harry, this was his daughter, and here you can see it's labeled 43, and this indicates the number of repeats, of the CAG repeats that they have. And you can notice that both him and his daughter actually have more, especially like in comparison to their other family members. And this is because normally the normal HD allele have between 10 to 26 CAG repeats, but they become mutated and you start developing HD when you have more than 36. So in this case, you can see they have 43. So this is the overall mechanism on how these repeats form. And so we saw so far that our Harry Dawson has been diagnosed because he came into the doctor and he showed his symptoms. And now they're able to also diagnose his daughter because of the number of repeats that she has. And this is a very common thing. And the way that this doctor was really able to diagnose this was because of anticipation. Anticipation is one of the main things about Huntington's disease and how it is diagnosed, because like we saw before, the symptoms aren't enough. And so if you look right here, do you remember how we said that his father died of a disease at 50 years old? And the thing with anticipation is that basically as the generations go on and the disease is passed on, the symptoms start coming earlier and earlier, and so does death, because Huntington's disease only allows you around 15 to 18 years to live, basically, after you have been diagnosed. And so when we saw that his father died at the age of 50, and our Harry Dawson is only presenting the symptoms at the age of 25, we can notice that the anticipation is happening sooner and sooner. So what are some further symptoms that we cannot observe? So these are two MRI images. So this one would be of a normal person. This one is of a HD patient. And you can notice here that the lateral ventricles within the brain are extremely enlarged. And the problem with that is that there is a nuclei which is around here, which is the caudate nucleus, which becomes completely atrophied because of the increased size in the ventricle. And the thing is, the Huntington usually it allows like normal function of the brain, and especially the transport of vesicles in the cellular circulatory pathways. And the problem with that is that actually this toxic amount of this mutated Huntington basically causes the death of neurons because it has a toxic effect on them. And this is why it affects the patients in such a way. So what's going to happen now to our Harry Dawson? So unfortunately, Huntington's disease does not have a cure. And the only thing that can be done, however, are some therapies. So for example, you can use this drug, tetrabenazine, which basically treats the chorea, which is the uncontrolled movements that he experiences. You can also use antidepressants, tranquilizers, because overall his symptoms are just going to get worse. His trembling will get so much worse. The loss of memory will increase more and more. And in the end, they won't, a patient of HD isn't actually able to live properly without help from others. So yes, overall, thank you. And that was a quick description on what Huntington's disease is, as well as the mechanisms.